That form of drug abuse is alcohol. Now, alcohol abuse, that is the most common one. Sometimes I wonder why people see drinking alcohol as a kind of, I know it could be fun to drink, you understand, but people see it as competition. Sometimes we often say now wolf dey pain belle. That's because if you use your money to buy alcohol, you are going to regulate what at the quantity you are drinking. Let's not lie to ourselves. But once you go and see free and a wolf, you go feel say okay, you don't arrive and today you want to take as much as. I remember some time ago I went to a gardening. All of us were just there. Then two guys were doing competition for who can finish 6 bottles of beer. At some point it was fun to watch. But another thing what came to my mind was, what are they trying to achieve by this kind of silly behavior? You understand? For them now, they're feeling that okay, I can finish 6 bottles of beer, I can do this, I can do that. When it comes to, so you are exposing yourself to some serious health crisis that we'll still talk about in this show today.
Hello guys, welcome back to another episode of the Vital D podcast, where we discuss about critical health topics and give you the latest insight to stay healthy and educated. I am your host, Etimbuk Ben, and today we are going to be talking about an interesting topic, dangers of drug abuse. And I'm here with my partner, Fam David, who will discuss about this topic with us. So Fam David, welcome to the show.
Thank you for having me.
Welcome. So Fam David, let's start with the basis. What is drugs abuse?
Like I said, thank you once again for having me. Drug abuse is the use of substance in a way that become harmful to the user and even to others. So once an individual uses a drug molecule or a drug substance that becomes harmful to himself that is using it or to others, that is a drug abuse. So that could include using a prescription drugs. That could also be the use of over-the-counter drugs, that is the OTC drugs. So the use of those things at the dose that is not intended for, or using it for a purpose that it wasn't intended for, that is drug abuse.
Thank you, Fam David. Can you give us an examples of drugs abuse?
Of course, there are so many examples of drug abuse, but let's start with a very common one: prescription medications. Once you take a dose of a prescribed drug higher than what was prescribed, that is drug abuse. Using someone's medication, that's drug abuse. Then even using over-the-counter drugs for purpose that is not intended for. There's some over-the-counter drugs that we can buy and then we can use for a purpose, and that wasn't what it was intended for. Once you do that, that is drug abuse. So there are also other examples in which you can also talk about using illicit drugs. Those are also forms of or examples of drug abuse.
Thank you very much, Fam David. What are the forms of drug abuse we can see today in our society? Okay,
there are many forms of drug abuse that I say is very common among us in our society, and these things happen among us even in our families, even in schools, even in our homes, our various homes, and even among our common youth. So I will start with number one, the prescription drug abuse. There are some prescription drugs that if you take at a certain dose, it could expose you to maybe a level of highness, anxiety. Those things are drug abuse. For example, taking some certain prescribed drugs such as the opioid, even some painkillers. There are some painkillers that you take at certain dose because it will expose you to maybe feeling highness, feeling that feeling of anxiety. So that is a form of drug abuse. Prescription drug is a form of drug abuse. Then we also have the over-the-counter drug abuse. There are some over-the-counter drugs that once an individual use at a dose, it could make the person feel some sensation or have that kind of feeling of highness. That's drug abuse, because you are using the dose for the effect it produced, not for the medical purpose of why that over-the-counter drug was produced. A common example is the cough syrups. Now there are some cough syrups, because of the active pharmaceutical ingredient it contains, that could expose one to drug abuse, or that can expose one to have that sensation of feeling highness or feeling energized to do one thing or the other. So once you indulge yourself in that, taking those doses for the effect it produced, that is another form of. So over-the-counter drug is also another form of drug abuse. Then I'll talk about illicit drugs. Now, these illicit drugs, I wouldn't really say that illicit drug, because most of these drugs are legal drugs. But once you are not getting it legally, You understand? Such as the cocaine that people really abuse but you don't know how they get it. So once you get those drugs, now those drugs are legal drugs because it's not as if it's a common drug, but because of the side effects it produces, the after effect. So people abuse the dose of those drugs. Now it has been legalized that there must be a prescription for it. There must be a reason as to why a doctor is prescribing for you to use that particular drug for a particular purpose. But if you lay your hands on it without any prescription, that means you are involving in drug abuse, and sometimes you are going to take at the dose that was not prescribed. And some people, because of the information they have on the internet, they can just have access to this name of drug, walk into one corner or the other, get these drugs and use it. They're abusing those drugs. Now they're not taking those molecules for the effect it produces. They are not taking those molecules for the medical purpose of it. They are taking it because of the effect it produces. So once you do that, you're encouraging or you're involving in drug abuse. Another form of drug abuse is alcohol. Now alcohol abuse, that is the most common one. Sometimes I wonder why people see drinking alcohol as a kind of, I know it could be fun to drink, you understand, but people see it as competition. Sometimes we often say now wolf the pain belly. That's because if you use your money to buy alcohol, you are going to regulate what at the quantity you are drinking. Let's not lie to ourselves. But once you go and see free and a wolf, you go feel say, okay, you don't arrive, and today you want to take as much as. I remember some time ago I went to a gardening. All of us were just there. Then two guys were doing competition for who can finish 6 bottles of beer. At some point it was fun to watch. But another thing what came to my mind was, what are they trying to achieve by this kind of silly behavior? You understand? For them now, they're feeling that, okay, I can finish 6 bottles of beer, I can do this, I can do that. When it comes to, so you are exposing yourself to some serious health crisis that we'll still talk about in this show today. So another one could be the use of nicotine product. Now, nicotine containing products, just like a cigarette that we smoke, those are excessive taking of those things can expose one to serious, because we are abusing it. We are taking it at a dose that wasn't prescribed. So once we do that, so those are forms of drug abuse. We have the prescription drug abuse, we have the over-the-counter drug abuse, we have illicit drug abuse, we have alcohol abuse, and then nicotine abuse. So those are the various forms of drug abuse that I can share with you today on this show.
Thank you very much, Fam David. So can you give us some of the dangers associated with this drug abuse?
Yeah, there are so many dangers associated with drug abuse. But first I will start with the health risks or the risk factors when it comes to drug abuse associated with health. Now, drug abuse has a lot of health issues, ranging from liver issues, for example, chronic people that consume alcohol, like heavy drinkers. There are people that drink alcohol like on a day-to-day activities, like they don't see it as it's against them. You understand? They see it as fun. You understand? They see it as fun to always want to finish maybe 3 bottles, 4 bottles. And now the common thing now, you go to all these bitters people are drinking. Sometimes I ask them, has there been any check the way people concoct or mix bitters in bars on lounge out there? Because you go out to some lounge or maybe some bar, someone will buy maybe a certain brand of bitter and add energy drink to those things. As in, I'm always like, what are you mixing? You understand? What are you combining? So you are putting your liver at risk. So alcohol could expose one to serious liver issues. So that let's not even go far. Those things are very, very dangerous to human health. So alcohol abuse could expose one to liver issues. In fact, liver damage sometimes. They look at the heart issues, heart-related issues for people that are taking stimulant abuse. There are a lot of young guys out there, because you want to prove to a lady, for instance, that you are a man. You are taking substance to act, you understand, to do the work that you are not supposed to do. You understand? Something that you are supposed to just be there for certain minutes. You are there for hours, feeling yourself because of one thing or the other you have taken into your system. So those things could expose you to serious heart issues. They will also talk about respiratory diseases or respiratory issues. For example, people that engage in severe smoking, you understand, you can be at the risk of respiratory issues like lung cancer, lung disease, lung infections. Another thing is that the mental issues. Once you engage yourself in drug abuse, you can have mental issues. That's why you see a lot of guys coming down with unnecessary anxiety, mental disorders. You understand? Those things are element, or those things are the after effect of drugs that I've been using. So those things, once you engage yourself in those things, you are exposing yourself to serious health. So the number one risk factor for drug abuse is health issues. Then secondly, we move to social issues. Men, a lot of relationship out there suffering because of drug abuse. I think I once saw a video where the boyfriend, I don't know why it was the husband or whatever, slapped a lady in the eye, and then I think the eye was always almost blind. Then after 2 days, I think the guy got her a week of about, is it a 1 million plus, like that. The girl came online and said, it's better for your man to slap you and then fix you. So when I look at those things, a lot of guys abuse drugs and their partner don't know, because of the fun things are making you have. You understand? Because I don't see any sensible man that will almost blind your eye and then buy you weak, and then you are comfortable and happy with that. Yes, I know you want to have fun with it, but sometimes you pay attention to the kind of guy you are dealing with. You understand? Most of them can be involving in serious drug abuse. So social issues is common these days. You understand? And those social issues also transpire to a work environment. Once you see someone that engaged in serious drug is having issues at his workplace, because he can't stick to time of going to job, he can't stick to doing the basic things he's supposed to do at job. Then legal issues, because sometimes you don't have money to fund those life, you will be having issues that will warrant someone charging you to court or whatever. So legal social consequences also is a major factor associated with drug abuse. Another thing we can also look at is financial issues. It takes very much, will I say, it takes serious effort for you to be a drug addict, because you need fun. Because once you become addicted to a particular medication, you need money to keep buying it. Okay, for example, someone that is into maybe a serious hard drugs, you need money. That's why you see some celebrities who come down and will always come out and say, at a certain point in their life, this is why they were very broke, because of drugs. You understand? Because those drugs, because of how legal it is not common for a common man out there. The only one that is very common for a common man out there is alcohol, that we can just walk into any supermarket or any bar and then buy. But when it comes to those hard drugs, those hardcore drugs, it's not common for any common man to get it. So people that can fund that lifestyle, they have the funds. But at the end of the day, one or two ways, they always come out to tell you that one of the things that make them go down financially was drugs. So drug abuse could expose one to serious financial issues. And once you find yourself in that state, you need help. You need help, because at that level you are now, it's a serious financial issues, and not just financial issues that is only to yourself, to your surrounding environment. So drug abuse has a way of putting one in financial debt. Even in common bars here, you see someone will come here, give me today, I'll pay tomorrow. Even some workers, there are some workers that immediately their salary come, it has finished. You understand? Not because they have not been paid, but because they are going to pay for the debts, just because of alcohol that have been taken over the week. You understand? That some of them over the weekend, they want to finish the salary that they have not even received. So it's a very serious issue. So we have talked about health issues, we have talked about financial issues, we also talk about social issues. Those are one of the major factors or dangers associated with drug abuse. There are so many of them, but because of time and for the purpose of sharing information out there, I think these are the ones that really affect us, because health is a major factor that drug abuse can lead ones to and expose one to. Thank you.
The dangers are indeed alarming. From David, what advice are you giving the individuals and communities to prevent drug abuse? How can they prevent it?
I will start by education. Well, by saying education. Let me say, for example, while we're in school in our 100 level, we did a course called GST, in which we did the dangers of drug abuse and other stuffs like that related to drug abuse. Now, those things we it wasn't just to pass the course, but it was also exposing us to this danger. So education is key. I know some people say school is scam, school is a scam, education is a scam, but it's not, because there are a lot of informations you can gain while at school. Like I know so many schools, like in the GSC, there's also a curriculum that they talk about drug abuse, that you need to know the dangers, because once you know the dangers associated with drug abuse, there will be as in, for you to engage yourself in it, it will reduce at least to small. So once education is at the high side, it will create awareness, and once awareness is there, a lot of drug abuse issues will be reduced in the society. The another thing is parental involvement. Our parents has to also look at the way we, the children, handle issues associated with a drug, because some parents just feel that because you're above the age of 18, they no longer have interest in whatever you are doing. And then parents, how they should encourage a close, I wouldn't say, yes, parents should encourage a close question kind of a relationship with their children, whereby they allow them, so not close, open-ended questions for their children, whereby they allow their children to express themselves. If you are from a family that they ask you a question and all you say is yes, no, it will not allow you to really express yourself. So if a parent can also encourage their children and they know what their children are doing, it will have a way of limiting drug abuse. Another way is community programs. Involvement in community program could also limit drug abuse. For example, I remember those days we used to play match balls in our community. So you see those period of we are playing ball, community programs like that, where we do community match. People that used to drink, I know during that period we are training morning and evening, playing match, the next day training. So they will not have enough time to go and take something or go and drink. So all their mind and focus will be on this match. So community programs like that could also help to prevent the occurrence of drug abuse in our society. So awareness is important. Education is very, very key too, because education is one of the best way to create awareness. So another thing, apart from education, I also say our churches, because it's a good thing while you are preaching about salvation, talking about tithe and all those stuffs in church, but it should also have a program that will address some issues the youth are facing. And one of the issues the youth are facing, even those ones that go to church, is drug issues, drug related offense. So they should also have a way of talking to the youth. It's not everything is about sowing seed. It's not everything about, yes, we also want to go to, at the end of the day, meet our savior, but at the end of the day, we also do the work that we're supposed to do here on earth, in which we also lecture people, create awareness, let people know about these things, because sometimes our society is also failing, because people see people do things they don't want to pay attention to, but not knowing that it's affecting them. Like a guy of, let's say a guy of 30 years old sitting down with a child of 14 years old and they're smoking. That boy of 14-year-old now is paying attention to how he's dragging that stuff. In the nearest future, he might want to try it out. So the society also has a way of influencing what's going on. So once we do this thing, education is key, awareness is key. The parent has to be informed, or aside being informed, they also have to be involved in what their children are doing. Once you put those things in check, then there will be limitations, and then we also have a way of preventing the occurrence of drug abuse in our society.
Thank you very much, Fam David, for that. What do you think is the role of the healthcare in this?
The healthcare professionals have a very big role when it comes to preventing drug abuse in our society. One, I would say, because one, they monitor their prescription. Sometimes once a drug is being prescribed, maybe some certain class of drugs, because of the active pharmaceutical ingredient that drugs contain, the doctor is aware that drug can expose one to highness, or it could expose one to anxiety, or some element of superactive behavior. They are aware that those drugs could lead one to highness, so they will always regulate the dose that are giving those drugs. So the healthcare professionals are doing their very best, because number one, they always regulate the dose. Then also they monitor the patient. And then they always educate the patient. So education, like I said, is very key. So our healthcare professionals are doing that. They're educating the patients on how to use a particular drug that they know that drug could expose one. In fact, I know some drugs that once you go to the hospital, they may not even tell you the name. They will just say, okay, they are giving this drug, that you are going to use this drug for a certain period of time. Please, once you are done with this drug, come back to the hospital if you want to get it again. You understand? Because they know that those drugs are prescription drugs. Because if you walk into a normal community pharmacy or patent medicine shop, they will not sell it for you without prescription. So they are doing their best by prescribing the correct dose, monitoring what the patient is taking. Because if they are not monitoring what the patient is taking, they will not be writing those prescriptions for the patient to get those drugs. So they are doing their best in that aspect. They're also educating patients. They will tell you, so this drug take at so and so time. Do not take more than certain dose. For example, maybe you are supposed to take that drug 10 milligram, for example. They will caution you not to take above 10 milligram, because if you take above 10 milligram, this is what you are liable to experience. So our healthcare professionals are doing their best, and also some of them are also offering support. Understand? Some of them are offering support, even financial support. Then counseling. They're also counseling patients on the dangers of drug abuse. So the healthcare professionals are doing their very best to also curtail the spread of drug abuse in society. They are doing their very best.
Okay, Fam David, for these individuals that are struggling with this drug abuse, what advice or what step can they take to prevent it or to stop it?
Okay, for people that are struggling with drug abuse, I think the first step or the first action is to acknowledge that you have issue. You can't help someone that doesn't want to be helped, because there are people that always feel they know it all or they can figure it out all on their own. So people that wants help, first is to acknowledge that you need help. Then secondly is the availability of counsel sessions. Those counsel sessions will help to reduce or to help an individual that has made himself or him or herself available, or anybody that avail himself that has acknowledged that he needs help. Those counsel sessions will also help. Then therapy is very, very vital when it comes to dealing with people with drug abuse. Then some community programs will also help. Then support group could also help. It will play a very vital role in helping one to stop it. Then for people that have issues with the overdose of a particular drugs, another thing I didn't mention earlier is, one of the dangers we talked about was overdose. Once you have overdose of a particular drug, it could lead to serious, even organ damage. It could lead to organ damage. It could also lead to a lot of health crisis. So in preventing it, we suggest a detoxification, so that we reduce the quantity of the fatal dose that the individual has already taken in. So doing those things will definitely help to prevent an individual that has issues with drug abuse in our society.
Thank you very much, Fam David, for sharing your knowledge with us on the dangers of drug abuse. So we have come to the end of our podcast today, and today's topic was drug abuse. And Fam David has told us everything we need to know, starting from the meaning, the prevention, and what the society or what the individual should do to stop drug abuse. And if you are struggling with drug abuse, the first step you have to admit that you are struggling with drug abuse, and also be educated on how to prevent it. So we have come to the end of our podcast show today. Remember to like, share, and subscribe. I'm still your host, Tetimbo Ben. Don't forget to stay healthy and stay safe. Bye.